Ever wonder why healthcare in America costs an arm and a leg? Like, literally.
Yeah, it's a question a lot of us ask.
We hear, yeah. So today
Huh.
we're doing a deep dive into this Vox video on YouTube. Um, it's called The Real Reason American Healthcare is So Expensive.
Oh, yeah, I saw that one.
Yeah, and get this. It might just flip everything you thought you knew about healthcare costs on its head.
I think a lot of people will be surprised.
Totally.
Yeah, one of the things I found really interesting is how this video tackles the idea that government-run healthcare is always less efficient than private.
All
But
right.
you know how some people think?
Right, that's like the classic argument against universal healthcare, right?
Exactly.
Like, oh, the government's going to mess it all up.
Yeah, exactly. And this video challenges that assumption right from the get-go with this really simple chart.
Oh, you mean that chart comparing healthcare spending in different countries?
Uh-huh.
The one where the U.S. is like way up at the top?
That's the one. But here's the thing. They break down the spending into public versus private. And guess what? The U.S. government spending is actually pretty much on par with other developed countries that have universal health care.
So it's not like the government is blowing our budget on healthcare.
Not really, no. What really sends those costs skyrocketing in the U.S. is the massive amount of private spending.
Wow. So that really flips the script on how we usually think about, government versus private efficiency.
For sure.
Okay, so if it's not the government's fault, is it because Americans are just going to the doctor all the time?
More than other countries.
Yeah.
Well, that's kind of a common myth, but the video actually uses data to debunk that.
Interesting.
Turns out Americans don't visit the doctor any more than people in other developed nations. We're just paying way, way more for those same services.
So it's not about how much we use healthcare. It's about the price tag for each visit, each procedure.
Exactly.
But why? Why is American healthcare so expensive in the first place?
Okay, well, imagine, just picture this, a system with hundreds of different insurance companies, all battling it out with healthcare providers, trying to negotiate their own separate prices.
Oh my God.
It's like a giant, chaotic marketplace, and that's essentially what the U.S. healthcare system is like.
That sounds incredibly inefficient.
Yeah.
Like 100 cooks in the kitchen all trying to make a different dish at the same time,
Yeah, I like that analogy. It's very colorful.
Yeah.
And all this back and forth negotiating means there's absolutely no centralized control over costs.
Right, I see.
And in contrast, countries with universal health care usually have their government act as a single powerful negotiator. Like
Yeah.
they set standardized prices, and that helps keep costs in check.
So it's like the government's this big, experienced chef who knows how to get the best deals on ingredients.
Yeah, I like that.
They can keep the costs of the meal reasonable for everybody.
Exactly. And you know who gets really squeezed in our system?
Ooh,
It's the people without insurance.
right.
They have zero negotiating power.
It's like being asked to pay full price at a restaurant when everyone else is getting like a special discount.
Yeah.
But it's not dinner we're talking about, it's healthcare. So the stakes are much higher.
Oh, absolutely, you're right. And the video actually mentions this study that found that hospitals charge uninsured patients 4 times more for the same ER visit
4 times more.
compared to Medicare patients. Yeah, 4 times more.
Oh my gosh. So our system is treating healthcare like buying a car or a house.
Kind of.
You haggle,
Yeah.
you negotiate, but that's just not realistic for most people.
No.
Especially when they're sick or facing an emergency.
Yeah, you're not really thinking clearly in those situations.
Exactly.
Yeah, the video makes the point that the consumer choice model, it just doesn't work when it comes to healthcare. It's not like comparing prices for a new TV, right?
Right.
You're vulnerable, you're making decisions under stress, you don't have all the knowledge you need.
It's a completely different situation.
Totally.
Mm.
And other countries recognize this. Their governments actually step in to negotiate fair prices for everybody.
So it's like those governments are acting as a massive buying group, using their leverage to get better deals for everyone.
That's a good way to think about it.
I'm starting to see why so many people are calling for a single-payer system here,
Yeah, a lot of people think it would be a good solution.
to at least address some of these issues.
For sure. But the video does point out some potential downsides to single payer.
Okay, like what?
Well, for one, even with a single payer system, you'd still have those powerful industry groups, like the pharmaceutical companies.
Right.
They'd still be lobbying to try and influence prices.
Right.
They'd still have a lot of power and influence.
Right. So even with single payer, there's no guarantee that healthcare costs would just magically disappear.
No, not at all.
I guess there's no easy fix for this problem.
Not really. And the video also brings up this issue of potential economic disruption. Like switching to single payer could have a pretty pretty big impact on healthcare providers.
Oh, yeah, I can see that.
Could lead to job losses or even some places closing down.
That's a good point. It's like any major change is going to have ripple effects.
Totally. But that doesn't mean we should just throw up our hands and say it's hopeless. Right.
Right, there's got to be some other options.
Yeah, the video talks about some other ideas that could help bring down costs.
Okay, I'm all ears. What are they talking about?
Okay, well, one approach is increasing government regulation of healthcare prices.
Okay, so instead of each insurer negotiating their own prices,
Yeah,
the government would set limits on what providers can charge.
exactly. Kind of like setting a price cap, you know?
Right, like how some countries regulate the cost of utilities.
Exactly.
At least then the cost would be more predictable.
It would create a lot more transparency, that's for sure. And it could help prevent these crazy high prices.
Right, but I bet the healthcare providers and insurance companies aren't too thrilled about that idea.
You're probably right. They usually argue that it would stifle innovation and limit choices for patients.
Hmm. I see their point, but I also see the need for more control over costs.
Yeah, it's a tough balance.
So are there other approaches that focus more on giving patients more control over costs?
Yeah, actually, there are. One idea that's been getting a lot of attention is promoting greater transparency in healthcare pricing.
Oh, interesting.
Imagine if you could easily compare prices for different doctors, hospitals, procedures.
Like when you book a flight or a hotel,
Exactly. Wouldn't that be amazing?
that would be a game changer.
Right now, it's like a black box.
Yeah, you never know what you're going to end up paying.
Right. You get the bill and you're like, whoa.
Exactly.
So, yeah, if prices were more readily available, it could create some real competition and hopefully drive prices down.
I can definitely see that happening.
Yeah.
But even with more transparency, wouldn't it still be hard for people to figure out all the costs?
You mean like with medical billing and all that?
Yeah, it's super confusing.
I know. But think about how technology has made it so much easier to compare prices for other things.
Good point.
We've got websites, apps, all kinds of things that help us find the best deals. We should be able to do the same thing for healthcare.
Like an app that shows you prices for a procedure in your area.
Exactly. And it could even show you quality ratings for different providers.
That would be amazing.
Yeah,
Okay, so technology can play a role.
definitely.
But what about policy changes?
Oh, yeah, for sure.
Yeah.
Like requiring healthcare providers to publicly disclose their prices.
Okay. And they'd have to do it in a standardized way.
Right. So it's easy to compare.
Yeah, that'd be huge.
Yeah, and make a big difference.
It feels like things are starting to shift
I think so.
in how we think about healthcare.
Yeah, it's becoming more consumer focused.
But I wonder, are there any solutions out there that go beyond just treating the symptoms of high costs?
You mean something that gets to the root causes?
Yeah, exactly.
There are, actually. And one that's gained a lot of traction is this idea of value-based care.
Value-based care. I've heard that term, but I'm not sure I really understand it.
It basically shifts the focus from quantity to quality.
Okay.
So in the traditional system, providers are rewarded for how many services they provide.
Right, more tests, more procedures, more money.
Yeah, but with value-based care, they're rewarded for delivering high-quality care that leads to better outcomes for patients.
So it's not about how many things you do, it's about how well you actually help your patients get better.
Yeah, that's the whole idea.
That makes a lot of sense. It seems like a much more patient-centered approach.
It is, but I'm sure you can imagine it's not the easiest thing to implement.
Yeah, how do you measure value in healthcare?
That's the million-dollar question, right? It's not always clear-cut. You have to come up with ways to track and evaluate patient outcomes.
And I imagine it requires a different way of thinking.
Totally. Providers have to think differently, and patients do too.
And it probably involves a lot more collaboration between different healthcare providers.
Oh, absolutely. They often create these integrated care teams, doctors, nurses, specialists, all working together.
So everyone's on the same page.
Yeah. And the goal is to make sure the patient is getting the best possible care.
So it's not just about changing how we pay for healthcare.
Nope.
It's about changing how we deliver it.
Totally.
It's a big shift.
It is, but it's gaining momentum. More and more healthcare systems are trying out value-based care models.
And are they seeing results?
Yeah, they're finding that it can lead to better outcomes and lower costs.
That's good to hear. But even if value-based care takes off, it doesn't address all those broader factors that drive up costs, right?
You're thinking about things like the aging population.
Yeah, and the increase in chronic diseases,
Right.
and just the crazy complicated administrative side of our healthcare system.
All those things play a role, for sure.
So many pieces to this puzzle.
It's a very complex challenge.
It can feel a little overwhelming.
It is complex,
Yeah.
but if we understand all these different factors,
Yeah.
we can start coming up with solutions.
Right, break it down into smaller pieces.
Exactly.
Okay, well, we've talked it a lot today.
We have.
Price regulation, transparency, value-based care.
Yeah, and all those trends that are driving up costs.
It's clear there's no single solution.
No magic bullet.
And, of course, we can't forget about politics.
Oh, right, the elephant in the room.
Healthcare reform is always a political battle.
Yeah, it's a tough one.
Maybe we can unpack that a little more in our next deep dive session.
Sounds good.
Okay, so we've seen just how complicated all these factors are
Yeah,
that drive up healthcare costs in the U.S.
it's a lot to untangle.
It is, but I think we got to talk about the politics of it all.
Oh, yeah, for sure.
Because any solution we come up with is going to face some serious political hurdles.
Absolutely, it's a highly politicized issue.
It feels like healthcare reform has been a battleground forever.
Yeah, for decades.
Maybe we can try to break it down a bit.
Okay.
Like what are some of the main arguments from people who are against major reform?
Well, one of the big ones you hear a lot is that government intervention will actually lead to lower quality care and that it'll stifle innovation.
Okay, so they're basically saying that a free market with competition and all that,
Right.
that's the best way to make sure we have high standards in healthcare.
Yeah, they worry that the government will mess it all up.
Right, like create a system that's slow and bureaucratic,
Uh-huh.
and that could hold back progress in new treatments and technology.
Exactly. And they often point to things like, the long approval processes for new drugs.
Right.
As evidence that the government just gets in the way.
I can see that point. Nobody wants to be denied a life-saving treatment because of red tape.
Right.
But what about the cost argument? Don't supporters of reform say that universal health care would actually save us money in the long run?
They do. It might sound kind of counterintuitive,
Yeah.
but their thinking is that a single-payer system would get rid of so much of the waste,
Oh, right.
all that administrative waste.
From having all these different insurance companies?
Exactly, all that paperwork, all the billing complexities. It's a huge drain on the system.
So if you streamline things,
Mhm.
cut out all that unnecessary stuff, you could potentially save money overall.
And cover more people at the same time.
Right. And they also say that a single-payer system would give the government way more power to negotiate lower drug prices.
Yeah, because if the government's the only buyer, they've got a lot more leverage.
That makes sense. But what about individual choice? Isn't that a big concern for people who don't want government-run healthcare?
Oh, yeah, definitely. They worry about being forced into, a government-assigned doctor.
Or treatment plan?
Right.
They want to be able to make their own decisions.
Totally. And it's a valid concern.
Yeah, it is. It's this tough balancing act, right? You want a system that's affordable for everyone,
Yeah.
but you don't want to sacrifice individual freedom.
Right.
It's a tricky one.
Yeah, and these are just some of the arguments that come up when we talk about healthcare reform.
So many different perspectives.
Yeah, it's a complex issue with valid points on all sides.
No wonder it's been such a political hot potato for so long.
Yeah, it's a tough one to crack.
But I feel like besides the cost and the efficiency stuff,
Yeah.
there's a moral dimension to all of this too, right?
Oh, absolutely. People who support major reform, they often bring up the fact that the U.S. is the only developed nation without universal health care.
Yeah, it's true. We're kind of an outlier in that sense.
And for a lot of people, it's a source of shame.
Yeah,
They believe health care is a fundamental human right,
right.
that everyone should have access to affordable, quality care no matter how much money they make or whether they have a job.
It's hard to disagree with that from a moral standpoint.
Right. It just seems wrong that your health should depend on your financial situation.
It's not right. And then there are millions of Americans who are uninsured or underinsured,
Right.
living with this constant fear of medical debt.
Yeah, it's a huge burden.
It's incredibly stressful.
Absolutely. And people who support reform believe that a universal system would lift that burden.
Give people peace of mind.
Yeah. It's not just about healthcare. It's about economic justice and fairness.
So where do we go from here? We've seen how complex this is, the practical stuff, the political stuff.
Yeah, it can feel pretty overwhelming.
It's a lot to take in.
It is. There's no easy answers.
But do you see any reason for hope?
I do, actually. I think public opinion is shifting.
Okay.
More and more Americans are saying they support universal health care.
That's good.
And as the problems with the current system get worse,
Yeah,
I think the pressure for change is just going to keep growing.
that's encouraging. It shows that change is possible, even if it's slow.
Yeah, it's going to take a lot of effort and a lot of tough conversation.
and a willingness to compromise.
For sure.
Well, we've covered a ton of ground today,
We have.
from the root causes of high healthcare costs to potential solutions
Yeah.
and all the political battles that come with it.
It's a complex issue.
But understanding the complexity is the first step.
Totally. It's
Yeah.
the only way we can start to fix things.
So to our listener, we hope this deep dive has given you the information you need
Yeah,
to really engage in this conversation.
it's important.
Stay informed, stay curious, and keep asking those tough questions.
Don't be afraid to challenge the status quo.
Because at the end of the day, we all deserve a healthcare system that's both affordable and accessible.
Absolutely. It's something we should all be fighting for.
And on that note, that wraps up our deep dive into U.S. healthcare costs.
It was a good one.
It was a lot to process, but thanks for joining us.
For my pleasure.
And until next time, keep those minds engaged and those conversations going.